Hello friends, today we are going to discuss how to read X-ray in case of the orthopedics. So there are various points you need to focus. So for your easiness, I have just divided those various points into the various steps, so it will be easy for you to remember. So let's start this. So I have divided those steps into the steps 1 to 4. Steps. In step 1, you need to focus on the film and the patient particulars. So when to come on the patient particulars and film details. In patient particulars, it's already written on the X-ray, the name, age, sex and hospital ID number. And in the film details, you just check for the site where the X-ray is and the side is the right or left, and the views whether it is AP or lateral or oblique or any special views. So this is the patient particulars and the film details. So in the film details, you mention the date of the scan is already written on the X-ray, the site where there is of the humerus or of the forearm or the thigh or the leg on the side, which is the right or the left side, and the views, the AP views, lateral views, and oblique views. In relation to the views, many of this external will like to ask you the rule of twos in case of the view. So I would like to point out here that rule of two. So two views. So it's two views on two joint, two side, two occasions, and two opinion. Okay, so two views should be available. Is a left is the AP or the lateral view, and a minimum two joint, one joint above the fracture site and one joint is below the fracture site is to be mentioned. Two side is the right and the left, especially in case of the children. On the two occasions, if the X-ray is taken at the time of the fractures, then it will be taken at after 2 weeks or 1 week to see any for displacement or see the callus formations, and the two opinions. Sometimes two opinions from the two different surgeons is required. So now let's move to the step number. In step 2, we will focus on the soft tissue. In the soft tissue, you just try to look for if there is any foreign body is not there, any kind of the calcifications or any soft tissue tumors which is visible in the X-ray. And in the step 3, you describe the bone, whether it's the fracture or any lesion. If there is any lesion, you have to describe whether it's a lytic lesion, sclerotic lesion, or any kind of the geographical lesion. Lytic. In fracture, while describing the fracture, I'll try to explain more detail regarding this. We have to describe the fracture at the site. Where exactly is the fracture? Fracture is at the proximal third or middle third or distal third, and whether the fracture is intra-articular or the extra-articular. So is the proximal third, middle third, distal third, or whether this is the intra-articular or extra articular. Then next comes the fracture classification, whether there is or oblique fracture or spiral fracture or green stick fracture or the buckle fracture, whether it's the comminuted fracture or the segmental fracture. Displacement. So you have to define the displacement of the fracture fragments, and while describing this displacement you have to mention according to the distal fragment in relation to the proximal fragments. So there are various points to be mentioned out here. Firstly, you have to mention proximal migration or apposition. Secondly, lateral or medial shift. Thirdly, you have to mention angulation, and then comes the rotation. So though my diagram is not so good, still I try to explain with the the diagram. Suppose this is the normal bone, this is the normal bone, and in this here there is a fracture here occurs here. So in this is the picture A, this is the B, and this is the C. So what you see here, this is normal bone where the fracture occurs, there is no displacement occurs, but in the fracture C you find these distal fragments sits proximally. So this is the proximal migration occurs at the fracture site. Now comes the medial or lateral shift. This is in picture there is no fractures in the picture B, but the fracture is there, but it's in place. And in picture C, you will just notice that the fracture fragment, this is the distal fragment, it moves laterally. Okay, this is lateral side, this is the medial side. So fracture fragment moves proximally and laterally. Now comes the angulation. Now suppose in fracture C you draw the line along this axis and you find there is no fractures, so there is nothing can be noted. In picture B, you draw two lines through the axis and you find it's in parallel with the proximal line is parallel with the distal lines. And in fracture C, and in the picture C, you will find these two lines, okay, along the axis of the bone. So when you notice that it forms, when you extrapolate this graph, this line, you find some angle is formed and here on the lateral side. So there's the angulation of the lateral side. The fracture is angulated, proximally migrated, and even there is a shift is on the lateral side. So angulation is also we have to mention. Now bone, suppose this is bone, there is a fracture at the mid shaft of this region, and in the fracture C, what you find that this whole bone is thicker and this bone was thin. So is the AP view of both the bones, but the same views, this bone is thinner than this much. So this bone, suppose this is bone, there is a fracture at the mid shaft of this region, and in the fracture C, what you find that this whole bone is thicker and this bone was thin. So is the AP view of both the bones, but the same views, this bone is thinner than this much. So this at the fracture side is not aligning with the proximal fragment. So some rotation is also there. So while seeing the rotation, you can see by simply matching the fracture site and also locating some points at the proximal and the distal fragments. Of all those points, we need to focus while reading the X-ray. Step 1, 2, 3, and 4, and the last in the step 4, you need to describe the articular surface, whether it is degenerated or not, whether it's a dislocation or there is a subluxation. You need to focus. So first you go through the topics, and then we'll try to read on the X-ray. Now we'll focus on how to read X-ray. Suppose you have given this film of this X-ray, and an external or examiner will ask you to read the X-ray. In this case, as we have pointed out, that in the step 1, we'll just describe the patient details and the film details. In the patient details, you can describe it here from the 46-year lady with, I'm not mentioning her name, but 46-year lady with hospital ID number 01794, with the date of the scan taken on the 4th of the September at around the 10 p.m. and this is the X-ray of left side of the leg AP and the lateral view, showing the knee joint and the ankle joint with some part of the portion of the foot in case of the lateral view. Now coming to the fracture classification, so there is the fracture at the junction of the mid and the distal third of the leg. When you just divide this whole leg into the three portions, and this is the proximal third, mid third and the distal third, and the fracture is at the mid third of the portion of this leg or the tibia, and this is the extra-articular fractures. Now coming to the simple oblique, the comminuted fractures is there. Combination is there, you can see the combinations, and the fracture, when describing the displacement of the fractures, then you find there is the proximal shift to this fracture compared to there is a proximal shift of the distal fragments, there is a lateral shift, and there is no such angulation but some kind of the rotation you find in case of the lateral view. Since there is a fibula is intact, so not much displacement is noted and not much rotation is noted in case of this of the fractures. Okay, and the soft tissue seems the okay, and the ankle joint and the joints also seems the okay. Thank you. So today we have learned both the theory portion and the practical portion, how to read X-ray in case of the orthopedics. So thank you.